The state has been making a lot of progress when it comes to vaccinations. Dr. Jennifer Dillahay from the Arkansas Department of Health and State Senator Joyce Elliott join us now to talk about where the state is now and the importance of getting vaccines out, especially in minority communities. Thanks so much for joining us this morning. And Dr. Dillahay, so the COVID numbers, the cases have been going down, hospitalizations have been going down. What impact do you think the vaccine has had on where we stand here in Arkansas right now?
I think the biggest impact is probably in the number of deaths that are occurring. We have vaccinated our most vulnerable elders, those that live in long-term care facilities, and these are the folks that are most likely to die of COVID-19. And then now we are also vaccinating people who are 65 and older, and they are also at high risk for severe disease if they get COVID-19. So the more people that can be vaccinated, the more likely we are to prevent severe disease, hospitalizations, and death.
Definitely. And one of those people who was recently vaccinated is Senator Joyce Elliott. So Senator Elliott, you had your vaccine, you posted about it on Facebook. Can you talk just a little bit about the importance of getting the message out to, Black communities that it's okay to get this vaccine?
Yes, I'm very aware of the history and all of the concerns people might have about taking the vaccine. So I have tried to be very, very public about my belief in the science. And so when I was lucky enough, I'd just been waiting my turn. When I was able to get the vaccine, I wanted everybody to know that, I am true to my word. I'm not just talking to the rest of my community saying you should get it. See me do it. I am doing fine. And understand that there are things that happen in the past. People might think they have reasons to be skeptical, but there are people who look just like me who were instrumental in this work to create this vaccine. And it's so important because in the African American community in particular, and it's true in other communities of color, there are so many of the pre-existing conditions that might exacerbate make the problem worse should someone contract the COVID-19. Yeah. So the Black Caucus met with the governor, in fact, just yesterday, talking about what else we could do to help roll out the vaccine and get it to these communities. And one good thing that's happened out of all of the work, right now we recognize a lot of it is really not so much skepticism anymore. It's a matter of making sure we have access in a way that is not what we assume will work for everybody. And so that was a great discussion we had with the governor yesterday, and we look forward to doing even more, those of us in the Black Caucus, and making sure we're getting out there and helping people understand this is a matter of health. It's a matter of life, and there's no reason not to take this vaccine.
Definitely, and you're right. Access is important. So, Dr. Dillahay, can you talk a little bit about how the vaccine distribution is going across the state? I know we've received more than 1 million vaccine doses so far. So, how is that going with distributing them?
Well, we've been really pleased with all of the vaccinators who have stepped up to give the vaccine. So we've been trying to give them in a variety of settings. So some hospitals have given them, and they continue to give them through special vaccination clinics. But now they're working with the clinics in their systems to give vaccines. Lots of pharmacies around the state are providing vaccines, and some of them are going to work sites to provide vaccine, and now more and more medical clinics will be giving them.
Okay.
In addition, the health department will be providing vaccines through the local health units in various locations around the state. And as more and more vaccine is made available to our state, we will be able to make the vaccine available in a greater number of locations, more pharmacies, more clinics, more local health units.
And real quick, I have one more quick question for you, Dr. Dillahay. A lot of people are saying, oh, we got the vaccine, our numbers are going down, we're good to go. What advice do you have to Arkansans to make sure that we keep moving in the right direction?
Well, it's likely that COVID-19 will continue to circulate, and it appears that it may have seasonality like the flu. So we want people to go ahead and get vaccinated now while it's their turn, because we do not know what will happen in the fall. And so people should not miss their opportunity to get vaccinated when they have it.
All right. Well, thank you guys so much for joining us this morning.
Thank you.
All right. We'll be right back.